Hi, and welcome back to our patient video library. I'm Laura, a patient navigator. I am here today on behalf of your oncologist, who has discussed with you about a device called port that is inserted under your skin for your cancer treatment. I want to go over some general information about port in 4 short videos. Be sure to watch video 1 to understand what port is and why it is needed. Video 3 for how a port is used and how to prevent infection and clotting. And video 4 to learn how to access and flush port at home. In this video, I want to explain what to expect immediately after a port is inserted by your surgeon. During the first 24 to 48 hours after surgery, the incision area will be tender and a little red. Most people don't need pain medications, and the discomfort usually goes away within 48 hours. If your pain persists, please contact your oncologist. You should also call your surgical nurse if you develop severe pain, increased pain, swelling, warmth or redness around the port, a fever of 100.5 Fahrenheit or above, bleeding from the port, swelling or a growing bruise. Keeping it secure and dry. The incision wound will be covered by bandage till the wound heals for about 5 to 7 days. Please keep the bandage and wound areas dry. It may be a good idea to take a sponge bath or take showers only after making sure the port side is covered and secured with a plastic wrap so water does not reach in. If you notice the bandage is pulling away, reinforce with medical tape until you see your oncology nurse. The nurse will check on your dressing within the next few days after surgery. Check your bandage daily for bleeding. If there's bleeding, press firmly with a gauze for 15 minutes. If bleeding didn't stop, call your oncology nurse immediately. If it's heavy bleeding, visit the emergency room. Wearing a seatbelt will put pressure on your wound. Try to avoid this by placing a small pillow or folded towel between the strap and the wound. No exhausting activities until your wound heals. Also, please do not lift objects heavier than 10 pounds, 4.5 kilograms during this time. After your wound heals, you can return to your normal daily activities. You can swim with your implanted port as long as there is no needle in place. Avoid playing any contact sports such as football or rugby. Feel free to watch this video as many times as you would like, or download the transcript to read. Be sure to watch the other videos on what is a port and why it is needed, how to prevent infections and clots, and how to use at home. If you have any additional questions, you are welcome to reach out to your doctor's office. Thank you and good luck.